Hello, my name is Tanya Gonzalez, and today I'm going to be doing my e-poster / presentation on Hodgkin's lymphoma. So we'll go ahead and get started right away. Okay, so to begin with, Hodgkin's disease is a form of lymphoma that's idiopathic and contractible at any age. Little is known about what causes the disease, but there are some elements like DNA, age, and acquired infections that make people more susceptible to the disease. Hodgkin's lymphoma is a disease that affects numerous Americans, but with early diagnosis, proper treatment, and advancements in diagnostic technology, Hodgkin's lymphoma has become highly treatable. So the image here shows a sample of lymphoid tissue from a lymph node, probably taken through a biopsy. We see that in brown, the Reed-Sternberg cells, which confirm that the patient has Hodgkin's lymphoma. They are abnormal cells with 2 nuclei, and they're rather large. So systems affected. The lymphatic system is the initial system affected by Hodgkin's lymphoma. Lymphomas are cancers that originate from lymphocytes, which are the body's white blood cells that fight off viruses and bacteria. Though Hodgkin's disease originates from lymph nodes, it has the ability to affect all the systems in the human body. This is because of the nature of its structure and function. So the lymphatic system is composed of various different organs. So the bone marrow, the thymus, spleen, tonsil, and multiple mucous membranes, such as the one in the bowels. As a result, this is the system's primary line of defense for foreign bodies, whose networks has to be able to reach most surfaces of the human body, as seen in green in this image. It does this via the lymphatic vessels and capillaries with additional help from the circulatory system. So some signs and symptoms. Early symptoms are similar to those of the flu, which include fever, night chills, fatigue, and sweats. And then in 10% of patients, we see that they experience pain post-alcohol consumption. And then not noted here, but is important in early symptoms, is that there is swelling of a lymph node. But it's just confined to one area. It gets severe when the swelling of the lymph nodes are not confined to one area, or you see just multiple of them throughout. So some examples include, but are not limited to, the compressed airways, obstruction of ureters, and added pressure on nerve, which hindered the use of certain muscles or organs. And this is just because of the inflammation, which adds pressure and pain to certain parts of the body or obstructs it. So visualized to the right over here is the chest x-ray of a patient with Hodgkin's disease. There is apparent enlargement of the mediastinum, or intrapleural space between the lungs, and then the lungs you see in black right over here, and this is just due to the cancerous cell growth in the lymphatic system, which run parallel to the mediastinum, where in a normal chest x-ray you just see the heart shadow right over here, and then kind of like the mediastinum up here. But you see just like this huge blob of white visualized in the image here. And then continuing on, we see this zoomed in abdominal x-ray, which shows lymph nodes running all throughout here. But then in the arrow you see the tumor. And then there's also this image that shows the inflammation of the legs as a result of glandular failure when Hodgkin's lymphoma is present in the human body. Cancerous abnormalities in the lymphatic system can cause obstruction and prevent flow of lymph throughout the body. And this can cause pooling sometimes in certain areas of the body. Obstruction of the lymph will cause like localized swelling. And then there are people who do get enlarged balloon-like structures near their face and neck too. But treatment options. So treatment options for these patients vary because it's all based on the diagnosis and staging of the disease, with one being early or not as severe, and 4 being the most severe, with it being all throughout the body and not confined to one area. And this is just evaluated through physical examination, lab testing, computed tomography, nuclear magnetic resonance examinations, and positron emission tomography. Physical exam studies the patient's status and presence of enlarged lymph nodes, and then lab testing shows the blood white cell count. And then CT and nuke med help localize and determine the size and structure of the cells and their abnormalities. Treatment plans can include radiation therapy, chemotherapy, and stem cell transplantation. These are the forms that are successful in ridding and limiting one's body of the malignant cells. They do come with side effects. So some common side effects with chemotherapy and radiation therapy are that patients experience hair loss, skin irritation, and fatigue. And then some latent effects that are common are, because of the increased radiation dose, are thyroid cancer and leukemias. So here we see a nuke med transverse chest scan of a patient with Hodgkin's lymphoma. We see fluid as a result of pleural effusion bilaterally in white, And then the picture below also shows a patient receiving treatment for stem cells. And then that's the machine that takes his blood and centrifuges it to separate the different components in blood for treatment. And then who's at risk? Hodgkin's lymphoma is an idiopathic disease, but there are some links that show possible viral infections that increase the likelihood. So exposure to measles around the time of pregnancy help increase a child infection. And then the Epstein-Barr infection, also known as mono, we see that the genome of the virus is present in 20 to 80% of the people with Hodgkin's lymphoma tumors, which might possibly mean that it's carried on through the DNA. And then we have people with HIV who are more likely to develop Hodgkin's lymphoma, but this can be a result of the cancer just being opportunistic and when a patient already has a compromised immune system. But then getting more into the demographics, we see that children with parents who have a history of Hodgkin's lymphoma are believed to be at higher risk. And then the ages of 15 through 34, and then those over the age of 60 comprise a large proportion of patients with Hodgkin's. And then males' chances are higher than those of female. That's shown in pediatric cases where boys make up 85% of those diagnosed. And then prognosis. Despite the nature of the disease, it is prevalent at a young age, and then studies show that that this form of cancer in children is one of the most curable forms. And then approximately 90% of individuals that are cured of this disease with chemotherapy and radiation. Most often women experience latent effects that produce breast cancer as a result of radiation exposure, yet both men and women alike are capable of running the risk of getting lung or thyroid cancer as well as leukemias. Only 2 to 6% of patients do obtain a more severe progressive cancer known as acute myelolytic leukemia. But with this slim probability, it's just a result of proper treatment to control the disease to prevent it from getting to a metastatic nature. But overall, because of the unknown origin of Hodgkin's disease, people aren't able to take preventative measures despite being a constitutional disease. Hodgkin's has a variety of treatments that make it one of the most curable cancers. But despite the latent effects because of the treatment and radiation therapy, chemotherapy used in practice, regular follow-ups are essential in the long-term health of the cancer patients and the remission. But in all, that is it. Thank you.